one of our user Karthik. He want to ask question related to that only, means latest treatment and lifestyle recommendation. So if you allow, then we will means add Karthik in this session.
Sure, absolutely.
Hi Karthik.
Hi, Karthik. How are you?
Hi, doctor. I'm fine, doctor. What about you?
Good, thank you.
Okay. Actually, my question is my grandfather was recently diagnosed with atrial fibrillation. I'm very interested in learning from the expertise of US cardiologists. And I'm particularly interested in learning about the latest advancement in the management of atrial fibrillation, including the latest treatment options and lifestyle recommendations from your side. Can you please give your opinion?
Atrial fibrillation, for those of you who doesn't know what that is, it's an abnormal heart rhythm where our normal heart beats or the heart's electrical activity, they all start from one spot on the top right side of the heart called sinus node. That's where the electrical signals they generate. It's like the powerhouse of the heart. So with each before each heartbeat, an electrical signal starts from that spot and then it goes down. There are some electrical wirings that goes down to your ventricles, that's the bottom chambers of the heart, and make your heart squeeze each time. Okay. In people with atrial fibrillation, these electrical signals, they don't start from that one spot. It comes from multiple spots in the top chamber of the heart, from the atria. So when it happens, usually when the normal heart signal comes in, it's like very rhythmic way, very regularly the heart beats. When you are in atrial fibrillation or AFib, the heart goes very fast like this. It doesn't squeeze like this. It just sits there and shiver or quivers or fibrillates like this. That's why it's called atrial fibrillation. So what the problem with that? It's a disease more common in older age, because when we get older, your heart muscle in the upper chamber can get scarred. We call fibrosis or scarring, and these electrical wirings around the heart muscle, they also get scarred, or there are some changes happen in the electrical muscles around the heart or the blood vessels around the heart. And that can generate these abnormal rhythms, and then it goes down to the ventricles, and it can make the heart go very fast sometimes. Usually your heart rate is considered normal between 60 to 100 beats per minute, between 60 and 100 beats per minute. So this atrial fibrillation, for no reason, your heart rate can go to 130, 140 beats per minute. Usually our heart goes fast only if you're doing some activities like exercising, or sometimes if you're very stressed out, anxious, it can also go up. That's normal response. But in atrial fibrillation, it happens for no reason. It can just happen randomly. So one of the big problems with atrial fibrillation is, remember I mentioned about the heart chambers not beating like this, but it's there and shakes like this. So when that happens, the blood does not flow very well around the heart, okay? So when the blood does not flow, it remains stagnant. It can clot inside the heart, and that clot can go to your brain, and that can cause a stroke. That's why we put people on blood thinners or anticoagulant medications. I'm sure your grandfather may have been put on that medicine. It depends, most likely. There are some reasons why we don't do that. If they have a history of bleeding, frequent bleeding, or if they fall often, or if there is any reason why they cannot be on a blood thinner, then they would not, we cannot do that. So, but on a generic, in a most common scenario, we put people on blood thinners. So the treatment for those are first line medications. And if you're recently diagnosed with atrial fibrillation, sometimes what we do is we shock your heart. We put some, have you seen on movies and stuff, where somebody gets a cardiac arrest, you put something and shock your heart to get it back to normal rhythm. So something like that, we can put some, apply some shock from outside the chest and try to get that person's heart back to a normal rhythm. Again, it's not a permanent fix. It's a short-term fix, because sometimes it may last for only a few minutes or a few hours. Sometimes it lasts longer time. So after this, usually we start people on certain medications called antiarrhythmic medications. So those medicines can help you maintain normal rhythm. And those were the only options we had in the past. But nowadays we have more options, more interventions. One is called an ablation, where we can go inside the heart and make some electrical burns around the heart muscle where these abnormal signals are coming from. It's like if you have an engineering background, you could say if you have a short circuit or something, you go and, or maybe some can go and solder around the area, or cauterize the area, and so that the wiring gets disconnected, or we can reestablish the normal wiring, so that there is no that abnormal electrical activity will be stopped. So those are the major and newer development, and this technology is getting much better, and it's becoming more widestream, this procedure. So once you have this procedure done, your chances of getting back into atrial fibrillation can get better. Some people may need more than once this procedure to be done, more than once or twice, but I think that we'll stop there for the time being. And it's a huge topic. We can, it needs to know your grandfather's more history, and to give us a more definitive answer. Again, lifestyle. You asked me about lifestyle. Weight loss is very important. If he is overweight, lose weight. Routine exercise. There's another thing called sleep apnea. There is a condition where people snore a lot at night, and that's a more common symptom. So if in those individuals, some may not snore, they may not know about it, but there's a condition called sleep apnea. Doing a test for that and treating for sleep apnea can also help reduce the risk of going into atrial fibrillation. All right.
Yeah. Okay, doctor. Yeah. Thanks for your opinion.
Yeah,
Thank you, Karthik, for that.